So welcome everybody on Blab and Facebook. We are here today. I'm Jeff Feynman. That's Christina Chambro. We're here today to talk about all topics: holistic, homeopathic, veterinary. We're going to talk a bit about the Austin AVH Homeopathy Conference. I want to talk a bit about the Montreal seminar. I'm trying to get out a little late here because the video is not coming across. This
Jeff, while you're playing around with that, I'm going to, you've started the recording, right?
I did start the recording.
Okay, good. So I'm going to, while you're getting set up, I'm going to go over a case. This comes from an old conference of AVH, and this was presented by a homeopath who's no longer practicing, Dr. Lori Tapp. And it just goes to show what depth, what we can do with emotional conditions. So this was a 7-year-old dog that had really bad skin problems, red, itchy, raw, all over the abdomen and the slot and the sides. Actually, it wasn't itchy. It was just a bad, really bad skin rash. And her whole life, she had been really sensitive to any change of routine and to being left alone. One time, she panicked when she was left alone outside, and she actually, on the fence, she tore a big hole in her leg because she kept running back and forth even after she tore the hole in the leg. She's shy and excitable with other dogs and with strange people. She's attracted to people. She wants to be part of the activity, but she's very, very nervous. She's both curious and fearful. She's social and reactive. And she's so intense that it really is of a concern to the, it's always been a concern to the owners. When she was at the vet clinic, she laid in the middle of the floor holding on to a blanket between her paws and sucking on, not chewing on it, but sucking on the blanket the entire time. And if the caretaker tried to take it away, her eyes would dilate and she would act as though she might bite. And this has happened frequently, that her eyes would be intense looking with dilated pupils, and people would move away from her being afraid that she would bite. And a lot of this happened after, seemed to always be worse after vaccinations. So the homeopath prescribed on skin eruptions, fear, problems from vaccination, and problems from rabies vaccination in particular. For that, we use the rubric mind, hydrophobia. I know that means fear of water, but of course that is part of the rabies disease. And so that has been a useful and very successful rubric to use. And then she used the word avarice. I'm not quite sure why. I guess for wanting things. So we never know what other homeopaths, how they'll interpret behaviors. And so a month after giving the remedy, and she's using an LM1 potency. So that means it's a very dilute and yet very powerful remedy that we give frequently. In this case, we're doing it once a day. And because she has such explosive problems at times, she wanted to give a low, gentle approach. And the remedy used was stramonium. And a month later, the skin was better. She was still fearful. And her reactions were not as intense. She looked less glassy-eyed. And she didn't suck as much on blankets when when company came, and was less intense. 4 months later, the caregiver stopped giving the remedy because the dog was doing so well. The eruptions were gone. The fear of being alone was 50% better, still not intense with any reactions. The caregiver can now take her to the park without worrying about a fight breaking out over a stick or toy, which I didn't pick up in the initial in the initial intake. She's less reactive and less touchy and no sucking. A year and a half after giving the remedy for that first 6 weeks. So it was given for about, it was given for about 2.5 months. And there are no skin eruptions, no fears. She can be left alone. The owners are not vaccinating. She's not very intense. She's not very overreactive. She can go to the dog park with no problems. She's sensitive and vigilant, but the caregiver can't remember the last time she thought she was going to bite, maybe a year ago. They even were able to get another dog in the house because she was no longer possessive and nervous. So that's just, I think, a great example of how this would have been treated conventionally, was with steroids and or antibiotics for the skin, probably antibiotics for the skin, not steroids because it wasn't itchy. And then the behavior would have gotten worse and she would have been put on Prozac or one of the other behavior modification drugs. And then she would have developed other illnesses. But in this case, by treating with homeopathy, both the emotional state and the skin improved dramatically. Okay, Jeff is still wandering around.
I'm here.
Does anybody have any questions or comments on, on treating a case like that homeopathically, or the reasons that we would want to be doing that?
And okay. Sorry, Christina. This is.
Want me to go on and do another case, Jeff?
Sure. If you have a sec, that'd be great.
So let me just mark that one. So this one is an 8-year-old collie type dog. And again, we're looking at skin issues and along with emotional state. So this is an itching dog with skin eruptions and a lot of hair loss on the trunk of the body. And she had been rescued as a stray who was in the road stopping traffic. And that was in 94. And 5 years later, she got one set of vaccines, but those are the only vaccines that she's gotten. The treatment in the past has been antibiotics and oral prednisone. And they would get better. The symptoms would immediately get better, but they would return in a month. Now, this is what we call palliation. So palliation is the quick resolution of symptoms with the symptoms coming back again. Or the symptoms start to go away, but they come back as soon as you stop the medication. Either one of those can be palliation, along with no general improvement at all. So there wasn't a whole lot for this case. The skin was a little dry. There was a little bit of dry, crusty eruptions. The hair was really thin in sort of circular areas on the trunk of the body, chest and thorax. And these were areas where there had been eruptions before. So it's sort of, I might have used poor healing for that. And so the rubrics used was skin eruptions, generalities, food, indigestibles. This dog would eat some dirt. So we're picking at straws a little bit here, but healthy dogs will not eat dirt. And vaccinations, I wouldn't have used because there was only one vaccine and no apparent reaction right afterwards. Just because a dog or cat has vaccinations doesn't mean they've affected the dog or the cat. Warmth aggravates. The dog really preferred to be in cold. And then the dog would hide in the bathtub when there were thunderstorms. So we used mine fear of thunderstorm. Now, interestingly enough, listen to a little bit of the history of this dog. The dog lives in a Zen Buddhist center and is allowed free access to the meditation room because she is so quiet and unassuming that she doesn't disturb people sitting in meditation. She'll move along the wall all the way around the room without touching anyone. She likes to be with quiet people. A few minutes of petting is enough. Too much noise, too many people, or a reprimand, and she leaves the room. She follows the caregiver everywhere, but at a slight distance. She wants to please the caregiver, but ignores almost everyone else. She really doesn't like other dogs touching her or getting near her stuff, and she'll even nip if they do that. She doesn't seek out confrontation, only if they are taking her stuff or approaching her. And so using those symptoms, which I would have picked a few others actually in there, the homeopathic remedy that was given is Natrum muriaticum. And they chose to do a low potency once a day. So they gave 6C once a day. And again, remedy choice, any remedy, any potency at all can work. If you give a potency that is too low, then you may discover you may not get a response at all. So you think you have the wrong remedy, when in actuality, the potency was much too low. In this case, I probably would have gone higher with maybe a 30C. However, I have seen profound, deep cures that happened with low potencies as well as really high potencies. It's like Jeff's finally getting this working. Good props for Jeff. So 2 weeks later, this dog was worse. The hair was falling out. There were more crusty eruptions. And nothing else we could tell, because there were no storms. There were no vaccines. There was no, she still didn't like to be warm. But the dog is now unhappy and has become withdrawn. So the homeopath still feels this is the correct remedy. So she decides to stop giving the remedy and let's see what happens. So 4 weeks later, a month later, the dog is reevaluated and the listlessness and withdrawing behaviors improved within a few days. And she seems happy and slightly more outgoing than she was when first started. The skin is better, but now starting to get worse. So she changed remedies to a closely related remedy, Natrum muriaticum. Now, Natrum muriaticum is very important for animals or people who have experienced a loss, experienced a trauma, and were and are deeply grieving. And so some of this dog's behaviors could be attributed to grief. So we make an assumption, then we give a remedy, then we see how they respond. So 8 weeks after giving 1 dose of 30C, the dog's skin is great, but the fear of, they did have a thunderstorm, and this dog was about 50% better, not retreating to the bathtub this time, was anxious and panted, but didn't retreat to the bathtub. 3 months after the last dose of Natmur 30C, so 8 months after starting the treatment, but 3 months after the Natrum muriaticum, 1 dose of the remedy, and the skin was completely clear. She's no longer licking dirt at all. She's anxious, but no panicking with thunderstorms. She's more outgoing. She's friendly with other people, not just with the caregiver. She occasionally plays with the cat and has even been heard to bark. So this dog has shown dramatic improvement once the correct remedy was found. And was it that it was the 30C, or was it that it was the correct remedy? It was probably that it was the correct remedy. Okay, that's it. So Jeff, you've been watching over there. Answer away whatever's been asked.
Yeah.
Your turn.
Trying to get caught up, and again, I apologize to everyone that, I'm distracted. I think this is going out on Facebook Live as well as, and it looks like we've got a couple of viewers over there as well. Kid asked about some techie stuff. So, no, we're not yet using it, Kid. And Christina had a great point there in that case about the vaccines. And unfortunately, it's one that gets missed a lot. That is that the use of a vaccine or just receiving a vaccine doesn't mean that the animal needs a vaccine, anti-vaccine remedy. And it doesn't mean that they're going to get vaccinosis. The stronger the individual is, the better the vitality, the better the health of the animal or person, less likely that a single vaccination is going to cause, or any single stress is going to cause a problem. And I think you made the point, Christina, that one vaccine, you're not even sure if you'd have used that in your analysis. And I agree.
Well, more that there was no reaction.
Well, that's exactly exactly it. In the presence or the use of just one vaccination, or even repeated vaccinations, don't necessarily mean that we need to use thuja or silica or sulfur.
Or listen, or hypericum, or ledum, or... And again, it's, as I say, we have an individual, each individual has a vital force, and each individual has sensitivities that are different. So one might have a vital force sensitive to vaccines, and another, vaccines aren't going to be a problem, but diet is the major problem. And others, chemicals might be the major problem. Others might be emotional state or drugs. So that's the uniqueness of each animal. So we don't make an assumption that whatever's happened in the past is causing the present. Very, very often people say, oh, my animal behaves that way because he was rescued, abused, a shelter animal. Not true. It's because his energy field is out of whack. Now, is it from that or from something else? We don't know. And yes, there are many things we can do to mitigate the negatives of the rabies vaccine, which legally you still need to be giving. Number one is, of course, be working with a holistic veterinarian. Because if you are working with a holistic veterinarian, they will not, and they may forget if they got a busy practice, so you may have to remind them. But if they say, hey, the rabies is due, should we give it? And you go, wait a minute, we're here for a problem. My animal is not well. We don't want to give the rabies. They'll go, oh, you're right, I forgot. And so number one, make sure that your animal is maximally healthy before any vaccine is given. Because occasionally, if you're traveling abroad, you may need to get other vaccines as well. Two, if you're working with a holistic veterinarian, they may be very well able to do something as they're choosing how they're doing the vaccination to make it not harm your dog. So very important to work with a holistic veterinarian to get your rabies vaccine. Number three is you want to, I like using Spirit Essences, has a combination essence called Vaccine Detox. And I'd recommend giving that for 2 weeks before and 2 weeks after. It's not going to harm. By giving it ahead of time, you'll see if it's changing any of the symptoms your animal has, so you have a baseline, at least a week before and 2 weeks after. The fourth thing is I want everyone, as you've heard me say over and over and over again, so get ready, to be attuned in Reiki. And one of the benefits of being attuned in Reiki is you can get rid of the bad in Reiki. So you hold the syringe in your hand and do Reiki on it. Oh, no, my veterinarian won't let me do that. You say, well, then get a new veterinarian, number one. Number two, if you're in a pickle and you need to do it and you say, I want to do Reiki on a syringe ahead of time, and they go, what? No. And you go, wait a minute. I've heard a lot of negative. I want to pray over this vaccine. They're not going to tell you no to pray. So doing Reiki there, and then you do Reiki on the injection site after the injection, and then you offer Reiki for the rest of the week. Finally, and very importantly, is that because you're keeping track of the symptoms in a journal and you're using the early warning signs of illness, you'll know if the vaccine has affected your animal even a little bit. So if they start having crud in the corner of their eyes, if they start having tearing discharge, little red line on the gum, runny nose, goop from the ears, or a mild recurrence of any of their other symptoms, then what you would do is turn to your homeopath and say, help, we're not well. And you'd probably give the constitutional remedy if you had it. And otherwise you would, figure out what's needed in terms of the homeopathic remedy. And then in general, you want to be boosting the health and the immunity. So that's a time to spend the most time feeding the best diet, exercising, giving lots of care. Just take that month as like, this is a super nurturing time right around the vaccine. This is the super nurturing. We want to do anything we can do to nurture this dog so that this dog or cat is absolutely as healthy as possible. So again, definitely with vaccines. Now, the other thing I now say about rabies, every time I talk about it, is that there is a new recommendation from the American Veterinary Medical Association, which is if a dog or cat is not current on their rabies vaccine and they get exposed to a possible rabid animal, like a dog bite wound, as long as they've ever been vaccinated even once, they do not need to be euthanized or put in a 6-month quarantine. That's really important. So in terms of forcing, being forced to give a vaccine, you can relax a little bit about it and not worry quite as much if you're overdue. Now, the laws in each state may not apply to that. The laws in each township may not follow that rule yet. It's very, very new, February. But it at least gives us a leg to stand on that we did not have before. Pretty cool, huh, Jeff?
It's very, very cool, and it's very positive on part of the AVMA, but unfortunately, like you said, it's not yet illegal. It's not in the laws of the states or the countries, but it's certainly just like the small dog vaccine study, which is proving that small dogs do not need the same dose of vaccine as bigger dogs, and that may help minimize the reactions. But just like that, it's not, when it comes to rabies, all bets are really off legally wise. Everyone has to do it the same way and have to follow the same legal requirements. But, there is more and more science that's coming up, that's being done every day, that shows that a lot of the legal requirements need to be changed. And I think that they are going to be changed really within the next couple of years. Pat Jordan, one of our colleagues who's a homeopath, holistic vet, naturopath, had just sent me a great review of a great book, Vaccines and Autoimmune Disease. And this is in people now, and they're showing pretty much that almost every disease that's been investigated can be linked with vaccinations. So there are antibodies that develop from vaccines against the kidneys, against the liver, against the thyroid, against the skin, against the joints, against the brain. Why do we want to propagate that? What we need to be doing is promoting the health of the individual, promoting a good, strong immune system, which doesn't need the vaccinations to artificially prop it up. And of course, we had a great presentation at the AVH conference in Austin about aluminum in the vaccines. Everyone's concerned about thimerosal and mercury, but Dr. Robinson and many others are finding that aluminum is actually as much, if not more, of a problem. Well, and the bottom line, I think, is that every time your animal or you get a vaccination, get a jab, it's a big insult to the body for a lot of reasons. Christina had some fantastic advice right there about what to do, going back to Jennifer's question about preparation for the vaccines. Not only should you try to maximize and optimize diet and exercise and fresh air around the time before and after the vaccine, but also very, very important to minimize stress. Because stress, it's funny, Dr. Sane, who's a human homeopath, does consider many things to antidote vaccination except stress. So, and the reason for that again is stress harms the balance, that delicate energetic balance of the body. So do all the good things, but also try to avoid stress. So if, surgery and anesthesia are stresses to the body. So if your animal goes to the vet and they're going to do a surgery or a dentistry or a procedure of any sort, and they're getting stressed and say, oh, he also needs his vaccinations, we'll just do it at the same time. No, do not do that.
Actually, I have to admit I was guilty of that when I was a conventional vet. I would make sure that if any anesthetic episode was happening for anything, I would look at the record, and if the vaccines were due in the next, this is so stupid, in the next 4 months, I would say, let's go ahead and vaccinate now. And my thinking behind it was, even though animals rarely yelped when I stuck a needle in them, it's like if I did it under anesthesia, then they definitely would not feel any pain. So my goal was to alleviate pain by doing the vaccines during the anesthetic. And nothing in veterinary school that I remembered learning taught me that it was a major stress on the immune system. And I never read the labels that came in the vaccine vials, because I'd been a veterinary assistant since I was 12 years old, and we gave vaccines all the time. So I never thought about it. So it was only once I became holistic and started thinking about it. So you all are lots farther along than I was in that area, for sure.
Okay, I'm just...
do you have the author of Vaccines and Autoimmune Disease? Was that Pat Jordan or someone else?
No.
Driscoll? Catherine Driscoll?
Nope, it's not a vet book. I thought I had it in my email, but I'll pull it up in my other folder. So just give me 1 second while I do that.
Okay.
And to have a list of talks, I wanted to just go over and kind of summarize what we learned, what the takeaway lessons were at Austin, and then
it's all on my computer, and I realized that I need to pull something off. We should pull it off and print it or something, so I can, or somehow figure out how to have it on here at the same time. I don't really have anything from Austin that I can look at right now and talk about. So I want to compliment Vegan Travel for reaching out to acupuncture. And even though her cat has lymphoma, with acupuncture, the cat is a new cat. She's able to walk without pain and is doing wonderfully. And definitely Chinese herbs and acupuncture have been known to cure lymphoma as well. So, and our goal is to have animals be as healthy as they can be, regardless of whatever medical condition they have. And then they either will or won't recover from the condition, but they'll have the best possible years for as long as they can. So acupuncture is, when it's well done, it can be excellent. And it's particularly good, I find, when there's symptoms and there's not a lot else going on, or there's symptoms and they're very ill or on a whole lot of other drugs. Sometimes with homeopathy, they may not respond quite as quickly in those circumstances. And so acupuncture can certainly help in that time. Acupuncture certainly, as well as homeopathy and doing Reiki on food, can get cats eating again. And, for you, the acupuncture worked. Her appetite was gone, but now she eats regularly. And it's good that you're starting the metronidazole. I would decrease that first. I would get her off of that first and then slowly decrease the prednisolone. So good job you're doing, but keep working, keep doing your acupuncture. It's not just one treatment. That's the other thing about acupuncture is it needs to be repeated on a regular basis.
And avoiding the pain meds, vegan travel was just so important. Such a great move, because out of everything, the lowest vitality of the individual, things like morphine, and now they're using methadone for pain relief in dogs and cats. Believe it or not, methadone, fentanyl, they're morphine derivatives. Those pain meds are usually not only not needed, but often contraindicated, and decrease the pain of the pain receptors, and the receptors that are important for the body to react really to any external source. And I have one other word of advice, only because I'm right now working with a kitty who has a hard tumor about this big in the back of its belly, actually transitional cell carcinoma of his bladder, and he was having problems eating. Actually, he had stopped eating, problems walking, and along with homeopathy, we're doing just a couple of drops of RX hemp. So it's a hemp product from RX Vitamins. Actually, it's called Hemp RX. You can get that online. You can get that from your vet. That will increase the quality of life and the appetite of most of the individuals that take it, and it tastes good. You know, it's a liquid. It's easy to give. It's very concentrated, and I really like it a lot. Do you have any experience, Christina, using cannabis or hemp in any of your patients? Or
The I'm taking it myself. I'm taking Rob Silver's product. He sent me some, and the first week I felt it did a big difference, and then not so much. But my intuitive, who I work with, said I should keep taking it, and that's for my musculoskeletal issues. So I am hearing more and more about it. It's more and more. Lots of studies are being done. Either this summer or spring issue, I can't remember now which, of the IVC Journal. And you all can read any of the articles from the IVC Journal. Just go to ivcjournal.com, and that will, and you can read these articles. So he did, I think he talked about cannabis. I think it was in the summer issue in the nutrition section, but it might be the spring issue. But I think it's good. So in terms of vegan travel, Gaithersburg and the Barn is good. I don't know if their acupuncture people there are maybe the best, but as long as you're getting good results, I would continue with them. If you feel at some point that you want a little more general holistic treatment, there is also in Germantown, Maryland, Dr. Pema Malu, M-A-L-U or L-L-U, and that's P-E-M-A. So we've all worked together. I mean, I totally respect the people at the Barn. They're really great. And in 1980, when I graduated from vet school, I was working with people from the Barn. So, but if you need more, I'm just giving you that as an extra option for that local area. And also Bethesda has a holistic practice that is at, oh good, Steinberg is now an acupuncturist, great. Still, Dr. Malou's been doing Dr. Brennan's, or has been doing Barbara Brennan's School of Healing, Intuitive Healing, and a bunch of others. So I'm just giving it to you as an option that you know, it's good to check them out as well. Good for Steinberg. Oh, I'm glad. I've talked to him about this forever. So that's very good.
Even Steinberg, he was a
neurologist. Steve Steinberg, yeah.
He was a neurology resident at Penn when I was there in the 80s. He's a nice guy.
Yeah, very nice.
Very nice. You know, he was in Maryland. Cool. Yep. There is a question on Facebook. Waiting list. Yep. The question up, and I keep twisting around to see the phone. Question is
We're going to
trying
have to figure that one out, Jeff, for you.
yeah, Kid had a great suggestion, and that's a product called Wirecast that might allow us to do both. But I have a feeling there's got to be a way, and I apologize I didn't have time to do this in the past in advance. But there's got to be a way to get the phone configured so I'm not having to do this, and they can see the blab, which right now is actually.
So what was the question?
The question is from Karen. Karen had a, I believe it's pup, but it's an animal with a cystic growth on the eyelid and some eyelid goop. She was wondering if there's a homeopathic medicine for that. She's already given Silica 30C. And do you happen to have your sign right there, Christina? Because yes, Taryn, there definitely is homeopathy.
Well, Karen, here's the thing. The point is, silica is one of probably 40 remedies that are listed for different kinds of eruptions around the eye and cysts around the eye. And so the key of selecting a homeopathic remedy isn't for a condition, for a cyst, but rather is for all the other things. I don't know if you were on earlier, but I talked about 2 dogs that had skin problems, and each one, basically the skin problems were fairly similar. One was itchy and one wasn't itchy, and one was losing more hair than the other, but they were pretty similar. Just like 5 cats or dogs may have cysts on the eyes, would be very similar, even though one might be an upper lid, one a lower lid, one bleeding, one not bleeding. So they may have some differences. But the way the remedies were selected here was more for the emotional state. So you need to be looking at, does your animal prefer cold or heat? Thirsty, not thirsty? Any particular foods that craves? Salt, not salt, sweet, not fish, cravings, aversions to foods, any past medical history, any conditions that have ever been in the past. So in order to select a homeopathic remedy that will be curative, you usually need to have all of those symptoms. Now, sometimes people are successful. They go to a book like Dr. Pitcairn's book, and they will read the section on diarrhea, or the section on limping or arthritis, and he gives 4 or 5 remedies. Or they'll go to Dr. Hamilton's book, Homeopathic Care of Cats and Dogs, and go to the eye section and read the 5 or 6 remedies that are there. And they'll try one remedy that seems to fit, and then the next, and then the next. And sometimes the problem will go away. So I'm not saying that won't ever work, but the very best way to get the deepest cure, see, the reason you have this cyst in the eye is that there's an imbalance in the energy field, not a big one. So it's a little imbalance in the energy field because the vital force was strong enough to put the disease to the outside, to the skin, and to make a little cyst. Not a big deal. So it's only a little imbalance, but the goal is still to rebalance the whole energy field as opposed to just getting rid of this one symptom, if that makes sense to you. So, so I would suggest learning more, taking a class and learning more about how to look things up with homeopathy. And maybe you've done that already. We don't know that.
And Blab, unfortunately, does not allow this. But if you're on Facebook right now, you can see I've got the rubric up on my screen of eye eruptions, growths on the eyelids. They've got 95 homeopathic medicines that have been used and that are useful for dogs and cats and people with eruptions on the eyelids. Certainly, as you said, silica is in there. It's actually not one of the more frequently indicated remedies in that rubric. And it's funny you mentioned eyelid growths and cysts because I just talked to a patient yesterday. I'm trying to remember, I think we were treating, I believe the chief complaint was was an issue with one of the legs. And by the way, that cystic on the eyelid that came up a year ago is now virtually gone. So we weren't treating, Karen, the growth on the eyelid yet, because we treated the totality of the individual, all the symptoms listed, like Christina just mentioned. This cyst was able to get resolved by the body. And that's one of the beautiful side effects, quote unquote, side effects of homeopathic care, is that frequently when we focus on a few symptoms, but if we do it correctly, do the process correctly, the whole well-being of the individual improves. And that's what we like to call the level of health, the overall level of health of the individual increases with homeopathy, whereas with drugs, the overall level of health either stays the same or actually decreases. And I think a great example of that, which I would like to talk to you a bit about when you're ready, Christina, I'm going to get rid of this group.
Go ahead.
Is Lyme disease.
Because what about Lyme disease? Just give Lidum.
Exactly. That's if you search on that, you'll find everyone, saying on the internet that you just do Lidum repeatedly and that will cure Lyme, and that's it. Because it was caused by bite of a tick. Lidum is one of the homeopathic medicines that's indicated for bites or puncture wounds. I personally have treated a ton of acute real Lyme disease in dogs. Actually, there's a video up on YouTube as well as Facebook. One of my clients actually that owns a training center was nice enough to make, I think it's a 3-minute before and after video of her dogs that could barely walk, and within 24, 36 hours or whatever it was, the dog was pretty much back to normal.
And that was using what remedy?
A remedy that rarely gets used for animals with Lyme disease because other indications in the case pointed to this homeopathic medicine. So I don't know.
I'm sorry, you got cut off a little bit. Which remedy was it?
Specific remedy? It wasn't Lidum.
Sure, because I want people to see that Lidum is not the only one that is successful.
Which I would not list in the first, second, or even third tier of homeopathic medicines that I've used for patients exhibiting acute Lyme disease. But the reason I brought this up is to go back to what I said about, the drugs are not going to raise the level of health. They're going to keep it the same or lower it. So the use of antibiotics for Lyme disease, true acute bacterial infections like Borrelia burgdorferi causing Lyme symptoms, certainly can get rid of the acute symptoms that absolutely are indicated for individuals not working with a homeopath in some situations for acute disease. However, studies are being shown more and more, and Dr. Whitmott, who's a fabulous MD homeopath, is showing more and more that the more antibiotics you use, the increased your chance is going to be, the greater your chance is going to be for future cases of Lyme disease. So actually the use of the medications is increasing the risk of getting the disease in the future, because what it's doing basically is decreasing the overall health of your immune system, and it's your immune system which protects you against the disease. And actually all infectious diseases, and that's one of the reasons why we're seeing more and more of these co-infections. Anaplasma, Ehrlichia, Babesia, Bartonella, What's a new one? Zika virus. I mean, these are things that have been around, but as our level of health decreases, those infectious diseases become more and more of a problem. And it looks like I'm missing a lively chat because I can't.
Oh, it was just the comment is, how do we treat allergy and asthma? And I said that what we're just saying is exactly how we treat allergy and asthma, which is to treat the animal, not the condition. And then the question was, well, how do we do that? And I said, well, it's about finding a homeopathic vet or a really good traditional Chinese veterinary medicine vet to be able to treat your dog. That's number one. And how you do that is I do have links on my page where on the links page on my website, I have all of the different organizations listed so that you can go to each organization to see who's near you, or you can work with a homeopath by telephone and you can find that from the homeopathic organization. But in addition to that, all the things we've talked about for home care are important. If you have animals with allergies or asthma, you want to improve the diet, decrease stress, make sure you're doing enough, exercise, whatever is appropriate for that animal. And you might need probiotics, you might need a fecal transplant, you might need to be adding different supplements. You may need some vitamin B, you might need some omegas. So there are different things that you can try. But the point is, most people are going to the wrong vet. So in most practices, they don't do any of this. When I was a conventional veterinarian and merely trained conventionally, I didn't do any of this. I was just like the vets in your practice. So that's why you need to find a vet who's trained in holistic approaches. And then you have to select one who's good, because a lot of people, not a lot, but there are a number of holistic veterinarians, even good ones. I mean, I have a local homeopathic vet who I love dearly, and she's now recommending vaccines and flea control and tick control chemical. And so I have to be careful when I send anybody to her now. So you still have to do your research and learn how you want to be treating your animals. And I've got an article on selecting and working with a holistic veterinarian on my website as well.
Sorry,
where are we? Mild renal disease, being treated with acupuncture. So here's the thing. I want to say something, because now this is 2 on acupuncture. So there's a distinction that we need to make here. And this is true in homeopathy as well as in acupuncture. So there obviously, I'm getting passionate about this. There are veterinarians who know that you want something different. And so they go take a course. It might even be the year-long course. They take a course, or they may take just a weekend course. And they come back saying they're doing acupuncture or they're doing homeopathy. But if you're going to be the judge of, are they doing it right or not? Okay, so it really falls into your hands. There are other people who have studied and taken maybe the same length of class who really get the holistic perspective. So if you have is that a cat or a dog? Must be a cat. If you have a cat that's being treated for renal disease with acupuncture, this cat, if you went to 2 different veterinarians, one veterinarian may say, okay, renal disease in a cat, here's the points. Let me go look it up in my book. They look it up in the book and they treat the points for kidney disease. Not good, not what you want. If, however, the veterinarian you go to who says we can use acupuncture to treat renal disease and that they've had success with that, if they ask you, so tell me about your cat. Tell me, what's your personality of your cat like? Does your cat prefer heat or cold? Since your cat's started drinking more, Have you noticed any other changes? Has there been any fears or aggression or any behavioral changes? What's the stool like? What's the history of your cat? What ailments has your cat had in the past? What things have helped those problems in the past? So when the acupuncture vet is looking at the whole animal, this whole energy field, and then selecting points, not for the kidney disease, but to rebalance all of the meridians, all of the meridians that are out of balance, that are blocked. When that acupuncture veterinarian looks at the tongue, feels the pulses, well, I guess they feel the pulses here and in the groin, but not so much on the paw. Then you're at the right person. So that's how you can tell the difference. If you go into a veterinarian and they say, oh, I can give you a remedy for renal disease, and they give you a homeopathic remedy, but don't ask all those questions, might not be good. Might be. It might be somebody who is so good and so skilled that they were able to read your animal just by walking into the room, and they gave you the right remedy. So I'm not saying to just ignore them totally, but you need to be more cautious if somebody does those approaches. So I hope that makes sense, because that's really important.
And
that vets want to do their best, but they don't always know how. And some of them just don't get the holistic perspective yet.
And that is a great point, Christina, but I don't know if I agree that it's so easy for people to figure out if the vet is doing good acupuncture or not. My advice usually is, are they quote-unquote medical acupuncturists, which are what you described as cookbook? They do this for that. And those are definitely the ones you want to stay away from. But unfortunately,
and again, go ahead.
I was going to say that unfortunately, that is the majority of the people out there that are doing acupuncture. They want to know what is being treated, and they put the needles in points that are indicated in some animals with that same problem. They're not looking at the totality of the individual. So yes, if you're able to go into a consultation and it's 10 minutes, and another one is 45 minutes or an hour, the odds are the first vet is probably not getting the totality of all symptoms. It's just looking at the chief complaint and needling for that, rather than treating your animal as a whole.
Or giving a homeopathic remedy. Although Christopher Day, when he first graduated from veterinary school, he's a leading veterinary homeopath in, we have cloned ourselves. I've worked for 25 years to clone me, and there's lots of me out there. Jennifer says we need to clone ourselves, Jeff, and there are wonderful homeopathic vets that are out there. Absolutely.
We all.
So,
thank you, Christina, because we're all there because you cloned yourself.
Well, and Richard and Jeff Levy and all those. But so the Christopher Day, when he graduated from vet school, was a trained homeopath already. He'd been raised that way. And he was working in a surgery where he would see a dog for 10 minutes and have to treat it. And then the next time he might not see that dog, one of his partners might see it. And he was still prescribing homeopathy in 10 minutes and was doing good curative homeopathy. So it is possible, but it's very, very, very rare. And I wouldn't expect it. Although there are times when people will walk in or call us on the phone and they'll give us such clear-cut symptoms in the first few minutes that we're pretty sure we know what remedy we're going to give. We're still going to take the whole history, but we're not sure. And we're almost to the end.
We are, and that is why journaling is so important, because writing down and keeping track of symptoms is going to not only let you a better idea of what's going on with your animal, but it's going to allow you to then go to your vet and concisely report what symptoms have changed, what's the problem, and that's going to lead more easily to a homeopathic remedy. I mean, in India, for example, some of the Indian homeopaths are seeing 100 patients a day. They're only seeing them for a few minutes. And they prescribe, curatively. Granted, not in every case, but certainly it's possible, like you said about Christopher Day. There are many of us, some of us that have a lot of experience, that have the intuitive sense as far as which healing modality and which homeopathic remedy is going to be best indicated. So, yeah, we didn't really have time. I want to talk a little bit about natural heartworm prevention. And
about what?
The Austin talk about natural heartworm disease prevention. And people will be a little better, little better prepared with the phone here. The phone's right here. You can watch yourself.
Well, we'll do natural heartworm treatment next time.
Yep.
And also Rosemary Manziano's parvo and distemper way to expose your dogs. And I would think it would work with cats so that we don't need to do any vaccines at all that Will Falconer talked about.
That would be great.
So I think that'll be great to talk about next time.
I've got also a list of cases like you presented at the beginning that we'll bring with us. Kate, you asked for my email address, which is in above, and anyone that wants to contact either one of us, do advise we both on both our websites. You can jump on our email list so you can get notification of any speaking engagements that Christina has. I'm in the middle of setting up an online course. Christina's in the middle of giving online courses. So we hope that we see you all there, and we really, really appreciate your coming and your participating. And anything else, Christina, before I stop the recording?
Nope. Have a great, wonderful day. Love those animals.
And thanks so much. Okay. Bye-bye.